What up, everybody? It's your girl Tata.
And your girl Zupa.
And welcome back to another episode of Fall Awake. On today's episode, we're taking a little bit more of a serious and informative turn, and we'll be talking about mental health.
Yes, mental health. And just like a disclaimer, we are no psychologists.
Or psychotherapists or all that.
Exactly.
Lived experiences is what we're going to be sharing here, and some research that we've done quite studiously.
Yes.
We went in on the research, so that's mainly the side that we're going to take on this and share with you all.
And mental health is a huge topic. We really want to do it justice. And there's lots of talks about it. It was recently a suicidal, prevention. Was it month?
I know it was a day, but I think it was month.
It was a month. So, it's a relevant topic to talk about. So first question is we hear a lot about mental health, but what does it really mean? A lot of these topics are very popularized and information can be scarce. Mm-hmm. So I really thought it was important to really define what it is. So a consensus definition of mental health is mental health includes our emotional, psychological, social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. So mental health is important at every stage of life, from childhood and adolescence throughout adulthood. So a lot of people think mental health is an adult thing, but children also experience mental health problems. So that's...
And something else that's really good to note is that 1 in 4 people, according to the World Health Organization, state 1 in 4 people will struggle with a mental illness in their lifetime, right? So it's for something that is literally 1 in 4 people, that's 25% of individuals, there needs to be a lot more work done within the different communities, and an understanding that viewing mental health, the symptoms itself, how it's even treated, has to be approached intersectionally, because the symptoms don't look the same for all communities. Even the way that certain illnesses manifest in us is not the same versus, let's say, male and female, black and non-racialized, and so on and so forth.
Exactly. And what gets tricky is that, for example, to be diagnosed with a mental health problem, there's the DSM-5, it's the Diagnostic and Statistical Manual of Mental Health, which is an American manual. It's the most used. But there's also the ICD, which is the International Classification of Diseases. So the ICD is used worldwide, whereas the DSM-5 is mostly North American used.
Westernized.
Yeah, westernized. So it's important to know that some of these definitions of mental health problems can differ from one manual to another. So we're going to give you a summary of it, but we welcome you guys to inform yourselves.
Yeah, and do the research.
Yeah, through the DSM-5, the ICD, just, get curious. So what happens with mental health is that over the course of your life, if you experience mental health problems, your thinking, mood, and behavior could be affected. And there's many factors that affect your mental health, such as biological factors. So this can be genes. It could be also life experiences, such as trauma or abuse, and family history of mental health problems. So in terms of trauma, do you want to expand?
I'm a big on trauma, especially because of my own experiences. And because of my own experiences and doing the research, I have not only the lived experiences of how impactful childhood trauma could be on your overall emotional, psychological, and even physical state, but that a lot of the issues that we see in adulthood and in young adulthood, even seniors, right, are undiagnosed or untreated traumatic instances that happen in early childhood while the brain is still developing. Yeah. And we are so focused on treating it in adulthood that we kind of, I feel that in some points have failed at really catering to the youth demographic, right? Because if we think about, a lot, even when it comes to PTSD, a lot of the traumatic experience that we remember, that we don't forget, that has changed the way we connect with other people, the way we even sustain or maintain our relationships, a lot of it goes back to how we were as youth. You know what I mean? Our experiences with our family, you know, dealing with sexual abuse, emotional abuse, violence, having, like you said, you know what I mean? Statistically, it's proven that if you have a parent who has, you know, even an undiagnosed mental disorder, you know, that puts children at risk, you know what I mean? Not just because it's something that can be passed down genetically, but also because of the environment, like you said, that it puts children in. And when we think about a racialized individual, our trauma does not just come, you know, from, these instances and experiences that we may have as youth. Trauma also comes from structural racism.
Yep.
It also comes from institutionalization. You know, it comes from the colonial undertones of the society that we live in today, you know. There was this therapist who made a quote that said, trauma in a person decontextualized over time looks like personality. And trauma in a people decontextualized over time looks like culture. Right? So if we look at the indigenous population, even in Canada, right, you know, how certain substance abuse issues and so on and so forth, when we look at the Black communities, both in America and Canada, you know, certain things that we have honed as culture, you know what I mean, they have been manifested through chattel slavery, through colonialism, and so on and so forth. So, you know, for racialized people, our trauma, not only is it transmitted generationally, but it impacts our mental health on a daily basis. You know what I mean? How we deal with racism on a daily basis has impact on our emotions, our psychology, even our physical health. You know, and mental health and mental illness is one of the leading causes of cardiac issues, cardiovascular issues, diabetes. The Black community has a high instances of diabetes throughout the entire community. You know what I mean? And they haven't really put specific correlations to it, but we could assume that, you know, mental health and physical health especially has an instance to do with, you know, the rate of diabetes in the Black community. So I'm an advocate for that when it comes to that, just because my own experiences, but I think there needs to be more done to understand even how the brain impacts to trauma, right? Like, if for my instances, for example, I've been in traumatic situations to the point that, you know, I have been able to take the time to become more aware of how it impacted the way I think. You know, when we have discussions and we're like, you know, I perceive danger, I perceive something, and then I become in a heightened state, right? So what they say is when someone is so used to experiencing violence or sexual violence or abuse for years, especially when it starts in their youth, it's hard for them to go back to a regulated emotional baseline after a trigger, right?
Yeah.
A trigger could be anything. A trigger could be something small, you spilling that cup, but because it reminds me of something that happened in my childhood or a traumatic event that happened years prior, not only does that lead to the PTSD about it, but it also, it makes me constantly act and perceive life out of my survival brain, right? So I'm no longer acting out of your neocortex, your thinking brain.
I am not in the present.
Yeah, exactly. And that's what trauma, that's the kind of impact trauma has on the brain. And that's how it often leads to mental illnesses, which you're going to list like personality disorders and all that stuff. Your mood could change so fast. Why? You're triggered, you get in a heightened state, your thinking brain you're not using your thinking brain. You're so used to being in survival mode. It's threat, panic, run, fight, freeze, right? Yeah.
Yeah, well said. You know, there's many. The thing about mental health, what we need to understand is like it's a spectrum. So your mental health, the term mental health itself doesn't mean that you have a problem, right? Mental health as a term means like physical health. It's neutral as a term.
Your holistic well-being.
Exactly. So from when we talk about the spectrum, it can go from just if you're a healthy person, you didn't experience trauma, you're just, you know, running for the bus and you're going to be late somewhere, and the chemicals in your brain secrete certain hormones that create that gives you adrenaline, and you're running for the bus, so you're experiencing anxiety in that moment. That is related to your mental health. So that's like on one end of the spectrum. And then you have things like schizophrenia, which is on the opposite end of the spectrum. But for us today, what we're going to focus on is like the middle mental health problems where it's hard to diagnose. A person with schizophrenia, I mean, you can tell that they're not well just by seeing them. But there's certain disorders that are very hidden.
Yeah, and mental health concerns that look very similar to other illnesses, so that's why it's often underdiagnosed.
Yeah, they're underdiagnosed, and they can be, because a lot of symptoms related to mental health can also be just normal traits, normal way of reacting or interacting with people or your environment. So some of them go very easily undiagnosed, and people live with them and are in relation with others, affect each other, sometimes end up harming others, whether it's physically or emotionally or psychologically, without knowing that what is causing that is an underlying mental health problem.
Because it's not normal.
Exactly.
Because we, like you said, when you said normal traits, we become so used to like certain behaviors that I adopted, I thought it was really me, right? But it's trauma perception, right? So the things that we will say, these are normal traits. Oh, she acts up, that's normal. She flips, her mood changes like this, that's normal. These things are not normal, you know what I mean? And we have to stop treating it like it's normal and enabling people to be the way they are, and really position people also for to receive the proper information, treatment, knowledge, and support.
So what we're going to focus on today, that I think I believe was more relevant, is things like anxiety disorders, mood disorders, personality disorders, and behavior disorders. And the reason why is because I think that all those things are kind of ambiguous, and the way they're interpreted in general can be confusing. And you can find yourself thinking, oh, well, this person, people are going to call other people narcissist, or psychopaths, But what is making you say that? What are the traits of this person that make you think that that they have this problem? So we just want to explore that. So if we start with anxiety disorders. So my issue with anxiety disorder is that it's become such a popular term, anxiety. Like, I have anxiety. Oh my gosh, I'm so anxious. I'm so this, I'm so that. But there's nuances to be taken into account. Like, for example, it's different to feel anxious and having an anxiety disorder. And there's things like phobias that elicit anxiety, but it's specific. So I have a phobia for dogs. I'm scared of dogs. I don't have anxiety disorder. I get anxious when I'm around dogs. You understand? So that's a phobia.
It could possibly lead to a disorder if you remain in a heightened state even after the dog is long gone, and it impacts the way you work throughout the day.
Yeah, well, yes. However, usually when it's a phobia, it's when you're around.
Yeah, no, but I'm talking about the anxiety of it, right? In that instance, if you had an anxiety disorder, it would have created such a heightened state in you, you wouldn't return to a normal regulated baseline throughout the whole day. So you're going to work and your work day is off. You come back home, you're off. Why? Because of an event that happened at 8 a.m. in the morning.
Exactly. So it's very important to normalize that anxiety is not just one thing. And it's not because you're feeling anxious now that you're an anxious person or that you have an anxiety disorder, because it does do a disservice to people who actually deal with anxiety disorder, where they can't go out, they're afraid of certain environments or people. And it's very important to know the difference. And the thing is that I feel like anxiety is very popularized because of
mainstream media,
and the fact that it's medicated. You understand? If pharmaceutical companies did not have, drugs that will numb you when you are feeling anxious or that will affect your moods, then it wouldn't be as popular as it is, I believe. That's my personal opinion.
Well, I'll let you share first, and I'll share some lived experience as someone who's been diagnosed with generalized anxiety disorder. So I'll share a little bit about my experiences also. No, I'll let you go first with the research, and then I'll just add on lived experiences to it.
Okay. Well, in terms of the research, it does basically say the different types of phobias. So you can have agoraphobia, like when you are afraid or you get anxious about a specific thing. And what is good to know with anxiety or phobias is that it's treatable. And one of the ways to treat it a lot of times is exposure. So, for example, if let's say you're afraid of spiders.
Oh, that's me. That is, why she have to do this one? Why does she have to do this one?
If you're afraid of spiders, like one way to treat it is that they can put you in a room full of spiders.
Yeah, which I'm trying to do to myself. I'm trying to build up that courage to do it, but
put you in a room full of spiders, and you would go, like, for example,
why did she start with spiders?
Every week to this treatment, and every week they would like increase the time that you're around the spiders, and over time your body becomes resistant to that anxiety, and you're less and less anxious when you're around spiders. You understand?
Yeah. So one day I feel like I'll get there, but I'm trying to go to the insectarium just to let a tarantula crawl on me.
Yeah.
Just so I hope I don't have a heart attack. But
and I gave
because
you
I want to get over that fear.
I gave you that example because last time you were at my house, it was crazy.
I was tripping, y'all.
And I'm scared of spiders too. I was just like,
I was tripping.
damn. Like, she can't even come to the balcony.
I couldn't even come on the balcony. And the worst thing, okay, just quick little thing. When I was in Old Port and I had to go to the bathroom, and you know when Old Port, there's the bathroom is like outside, inside type vibe. There was so much spiders on the ceiling. I sacrificed peeing because every time I walked to the door, I tried so hard to get my body through the threshold, but I couldn't. I tried maybe at least for like 10 minutes. Everyone kept going in. I'm like, oh no, go in front of me, you know? And then I walked back, I build up the courage, I walked back in, and I just couldn't get through. So understanding like the phobia coupled with anxiety, yeah, there was so much anxiety that I could not even go to the washroom. You know what I mean? But if it was an instance where like, you know, a small child was running away or my cat was running away, you know what I mean, in the bushes, I wouldn't even think about spiders. I would just go into acting,
Exactly.
you know what I mean?
Yeah.
So different situations, different contexts for sure.
Okay. So you can go ahead and share your...
Yeah. So I was recently, okay.
Generalized
I've been
anxiety
diagnosed with a
disorder
lot of stuff. First of all, but I don't take medication for everything. You know what I mean? The only things that I've really kind of dabbled in medication is with depression, and for anxiety. So sometimes, like I didn't understand, but this is something that's been happening to me since like 2005. But I'm so used to being hyper. Like my brother has ADHD. My mother is undiagnosed ADHD, I say. She can't stay put, you know what I mean? And I tend to be, I feel like it's over-functioning anxiety, right? Like, I get, my heart starts racing for no reason. My body could be still. My heart starts palpitating, and it'll feel like I just ran like a 100-meter race, right? And I start having to take deep breath, right? When it hits me and I'm not aware, sometimes I get panic attacks. So I can't calm down. I start crying and I start hyperventilating. How it first came to be is when I was first conscious of it, I was actually working at Marciano downtown, and it was Christmas time, so, you know, enough people. And I was assistant manager, so I had to not only, manage the floor, manage the cash, oversee pretty much everything. Long lineups, people calling my name all over the place. And then in the end, I had to take over the cash because we had a new cashier, and she wasn't really doing, she didn't really know how to do
her job
fast enough. I didn't want to say that, but like Zupa's like the reality. So now I'm there, and people are calling my names, and I was like, and someone's like, yo, are you okay? I'm like, yeah. I'm totally fine. And they're like, no, you're not fine. My face, okay, yeah, brown skin, but you know, we still get red sometimes, you know what I mean? My face got red. I couldn't breathe. I started coughing, like way too much. I couldn't catch my breath. And then it's just so happened that someone was there who practiced mindfulness. So they like raised my hands, deep breath. They had me touch like pin pressure points on my body to calm myself down. And, you know, even at that, I still didn't think of going to get it checked until I started my graduate degree. Oh, actually around COVID, when COVID happened, because it was just so much changing so fast.
Sorry to cut you off.
Yeah.
Marciano to when your graduate program, how long was
Oh,
that?
that was 12 years.
Yeah.
12 years.
I thought it was important to mention
It's important to mention 12 years without seeking professional help, without even understanding or taking the time. Yeah, exactly. So then throughout those 12 years, I got used to, when I get that feeling, I'm overproductive, because I feel that by me moving around a lot, it makes sense for me to feel like that inside. Right? Because usually for someone who's moving around a lot, doing a million things, it's understand you'll be you'll be at a heightened state. Your heart will be a little bit like racing faster. It'll be pulsating faster and everything like that. Your blood flowing faster. But when you're sitting down like this, and then all of a sudden your heart starts palpitating, you can't breathe. You know, it used to really scare me. So then I just kind of associated that with like, you know, let me try to stay busy. So even now, sometimes when I'm on medication, it plays with my mind, because I know I am calmer than I should be for all the shit I have to do. You know what I mean? So even at that, I try not to medicate myself too much. I only really take it if, let's say, I'm in public, I'm at a conference, I'm in a meeting, and you know, you need to act normal. Right? But other than that, at home, I really try to do some mindfulness exercises. I think has worked the best with me in regards to really trying to connect my thoughts and my feelings and what I'm feeling in that present moment, and rationalizing it, right? But everyone's experiences are very different.
Yeah,
like
that's what I wanted
don't look at that for me, because like she said, 12 years of it being unchecked, that caused 12 years of it impacting my relationships, my personality. People just saying, oh, she's too much tata. People used to call me too much tata. I was too much because I was doing the most. You know what I'm saying? I was doing too much. You know what I mean? It's not not a joke.
It's very, I think this is very interesting in terms of anxiety versus anxiety disorder. So now you can have a different mental health problem, and one of the symptoms of this mental health problem is anxiety. Because for example, thank you for sharing. And me, I have experienced anxiety, but I haven't been diagnosed with an anxiety disorder. But I was going at the time that I was experiencing it. First of all, it was the onset of it that led to me seeking help. I would think I was like 22, and I started just feeling really shitty. Like all I did was sleep. I didn't want to wake up. I didn't want to get up. My appetite went down. I lost so much weight. I wasn't happy. Like I just generally didn't feel like anything would make me happy. So I wanted to stop working. Like, so I didn't want to work anymore. And I was working. I wanted to go and leave because I hated my job so much and I was so unhappy there. So I went to a doctor just, to get a leave. And when I was talking to them, they're like, okay, they diagnosed me with like major depression. And this was going on for like over a year. So, but what led me there is that I would feel a sharp pain in my chest and I would be out of breath. Like I can't catch my breath. And then to the point where I would it's like I can't catch my breath to the point that I pass out.
Yeah.
Right?
It's so hard to get a hold of yourself.
Yeah. And then people around me would call the ambulance and then we'd go to the doctors and they're like, you're good. Like there's nothing. And back then it was not as popular as it is now.
Yeah. No.
So it happened like maybe 2-3 times until like at the emergency, they're like, okay, let's refer you to a psychiatrist. So when I went to see the psychiatrist and I was explaining my symptoms, that's when they were like, okay, so you have major depression. But the biggest symptom of that led me there was anxiety. You understand? And yes, they did prescribe medication, but I'm African, so it's just like, I'm not going to do that.
That's another thing that we need to talk about. That's another thing that we need to talk about.
I was like, listen.
The Black community and mental health, and we definitely going to touch on that today.
But I really didn't touch it. I was like, okay, I'm going to try to figure out. I started researching like what are the other things that I can do. That's when I got into yoga, like intensely. That's when I got into like mindfulness and learning how to meditate and stuff like that. And I kept reading, and I started seeing things like you have to figure out what is not working for you in your life right now. And the fact that I was not in school, I had major guilt about that, and I really wanted to be in school. So I'm like, okay, let me just take one class as an independent student. And then it made me feel much better. And then I started to identify my triggers. And then, okay, this triggers me. When this happens, it makes me feel like this. And then over time, I learned how to manage my anxiety. So sometimes when I find myself, years later, when I find myself in a situation where I start feeling like anxiety coming over me, like uncontrollably, like that time, I know something is not working and a change has to happen now, you know? So for example, when I was in a relationship and I started feeling anxious and I would have like anxiety attacks, I was like, okay, no. Like something is really wrong right now. And even after that, when I started doing, when I was on my own and I'm struggling, I'm doing things, I'm a single mom now, a lot of things were hard for me, but I was not experiencing anxiety because my mental health, my mental health was fine. You know, I'm making a lot of moves that require a lot of energy from me, but my mental health is okay. You understand? So then I don't have to focus on my mental health. Maybe now it's my physical health. That's the nuance to know. Like your mental health is just like your physical. If you're going to the gym, you're feeding yourself right. You're doing this to your body to make sure that your body is good. You have to do the same for your mental health.
Yeah.
You know? So I just wanted to highlight that because there's a nuance there. You can experience anxiety, but that is not generalized or a disorder. You can experience it in different instances, you know?
Yeah.
So, yeah.
And before you move on, though, just to touch on, because it's like we're talking a lot about managing our mental health and, just to be 100% transparent, being able to even do mindfulness exercises came very late in my life. I'm 34, and I have adopted pretty maladaptive practices and strategies to get me through my slump, and people need to be aware of that drug addiction too. That's a way that a lot of people try to cope with their mental distress, with their emotional distress. That is something that I, did for 10 years of my life. And by the grace of God, that is not an issue anymore, but people need to understand also is that when you look at someone who even has substance abuse issues, we're focusing so much on the act, we're not taking the time to think about their mental state too. And a lot of it for me personally came from depression, So we're talking a lot about managing ways, like, you were talking about mindfulness and exercise, but being real, there's also negative ways that people deal with their mental health. And, just not to make it seem like it's some easy thing it's not. And, just to meet yourself where you're at, no matter where you're at in your journey and get the help.
Okay.
Yeah.
So let's move on to mood disorders. Mood disorders can also be called affective disorders. So for those that you guys would probably hear of, it's like bipolar disorder and depression are mood disorders. So in the term given, a group of diagnoses where the essential characteristic is a disturbance in mood. So this group of diagnoses include depressive disorders and bipolar disorder, which are differentiated based on the occurrence of a manic or a hypomanic episode. Approximately 8% of adults will experience major depression at some point in their lives, and approximately 1% will have bipolar disorder. Individuals with mood disorders often suffer distress or impairment in social, occupational, educational, and other important areas of functioning. So this is I feel like it's important to know about mood disorders and to differentiate, because sometimes you can say, oh, this person is bipolar or this person is narcissist. Those are two completely different types of disorders. So the one that I really wanted to touch on here is major depressive disorder and I have a hard time pronouncing this word, dysthymic disorder. So the reason why I want to touch on both of those is that, major depressive disorder depression is popular. And I feel it's like a normal thing to happen with the type of life that we're living.
I wouldn't say popular, I'd say more ubiquitous right now with this shitty world we live in.
What do you mean?
Like, I wouldn't say popular, like, but I mean, like, it's ubiquitous. Like, we see it throughout society.
That's a big word, guys. Do you get it? Because
Oh my
I
God.
don't.
It just said it's prevalent everywhere.
Okay, prevalent. I know that one. It's prevalent. So, okay, my mistake. Not popular as in everybody's talking about it, but it's more common to happen.
Yeah.
Based off of
Or to be diagnosed with.
Or to be diagnosed with, or even not diagnosed. I think people do experience depression without knowing it's depression. But what I meant was that in the type of society we live in, with all the societal stressors that we experience, having depression should not seem as far-fetched. That's the point I was trying to make. So so that is that clinical depression or major depression is characterized by the presence of at least one major depressive episode, at least 2 weeks of depressed mood or loss of interest in usual activities, every day occupied by at least 4 additional symptoms or of depression. So, and these have to be recurrent illnesses with frequent relapses and reoccurrence. So major depression that's how it's characterized. It's very important to know that some of these symptoms, like feeling loss of appetite or feeling shitty and being under the weather and not wanting to get up in the morning, those are things that can happen in life in general. But if it's persistent for about 2-3 weeks and it comes and it lasts long, and then you get out of it and at some point it happens again, then you can be at risk, So dysmorphic disorder consists of chronic depressed mood that occurs for most of the day, for more days than not, over a period of at least 2 years, without long symptom-free periods. The symptoms are less severe than those seen in major depressive disorder, but they are longer. Individuals with dysmorphic disorder report feeling a lack of productivity and a difficulty in enjoying activities or having fun. As a result, its prolonged nature, dysthymia, can be very debilitating. Individuals with this disorder are also at high risk of experiencing an episode of major depression. So I want to highlight dysmorphic disorder, highlight it, because this is the most common mental health problems in Black people. Okay? And why? Is because as Black people, we have been conditioned to overproduce, even in very harsh realities or conditions, right? So dysmorphic disorder is basically going through life with depression, not knowing, not paying attention to it, and then over time, it affects your physical health. It's going to lead to things like diabetes, like you were saying.
Cardiovascular disease.
It affects your immune system to the point that you become, your immune system, your body is less able to regenerate itself. You are sleep deprived. You are always in fight mode, fight or flight. So your adrenaline glands are always overworked. And so eventually what it leads to is cardiovascular diseases, diabetes, a number of health problems. And that's why you see that a lot of Black people who have experienced like hardship in adult years, like later adult years, they start developing these diseases. And you're like, oh, what happened? Like, I was okay with my whole life. No, you were living under dysmorphic disorder for 30, 40 years.
And that's something people fail to realize, that a lot of the diseases that we see in our life, you know what I mean? Were founded in mental, emotional, and psychological issues that go untreated. It like you said, not only does it impact the brain, the chemical reactions in our mind, the pathways, the connections, you know what I mean? But our entire immune system, our entire body, you know what I mean? Like when we hear someone say like, you become your thoughts, you also become your feelings.
Yes.
You know?
Yes.
And that is like negative emotion literally epitomizing in our body in the form of disease.
Exactly. And that's why Tamara and I think you've probably heard us say this before in other podcasts, resilience. When we talk about Black people being resilient, this is why we don't promote it. We don't promote resilience because that's what resilience leads to. You think like, okay, you know what, I'm pushing through, which is also high functioning depression.
Yeah.
This also is related to the Smithic disorder. You know, like we're constantly producing when our mental health is not okay. And eventually, and we see it as resilient. People are going to say, oh my gosh, Black girl magic, those kind of things can be toxic, and we have to be mindful when we promote them. Oh yeah, this person is excelling regardless of their childhood trauma with the da-da-da.
Yeah.
But what is at risk is their mental health.
Yeah. And it's important because when you think about it, there's been so much stigma around mental health and the Black community, you know? So for this being something that we know impacts the Black community at such increased rates, and we have to like dive into the reason and the disparities between, you know, non-racialized people, how they view mental health concerns, how they are treated, you know what I mean? Even the media around it compared to Black individuals, you know? There's a reason why, the Black community as a whole deals with mental health concerns and issues very differently. And that's because of the stigma, not only because of the public stigma that involves more of a negative discriminatory attitude that society as a whole have towards the Black community mental health concerns, like we've seen here in Montreal, with men who are in mental distress getting shot by police in NDG. You know what I mean? The media and society doesn't treat us the same with respect to mental health. There's also the self-stigma, which refers to the negative attitudes. That's also includes internalized shame, and institutional stigma, which is more systemic. But for the Black community, according to this University of California of Social Work, it states that there are several barriers to mental health within the Black community. And one of it being the reluctance to seek both physical and mental health care because of the distrust between the medical establishment. You know, if we think about the Tuskegee experiments, right, when they were injecting syphilis in Black males and these people were expecting treatments, you know, if we think about forced sterilization of Black, Indigenous, and disabled poor people, you know what I mean? A lot of that, which comes from, you know, low-income Black and racialized communities, you know what I mean? There's reasons why that stigmatization has been founded. There's reasons why a lot of Black people don't get help. Another one that the School of Social Work of the University of California stated is that seeking mental health care is often viewed as a weakness, right? Running counter to the survivalist mentality born from systemic oppression and chronic racism, which people like to call resilience. I'll repeat it, running counter to the survivalist mentality born from systemic oppression and chronic racism that today people love to say is Black resilience. This is a survivalist mentality. This means that for a majority of Black people, we are constantly working from our survival, fight, or flight brain. Another barrier to mental health care that leads to stigmatization into the Black community is also the religiosity. Right? This one obviously was taken from the States, but they said a high percentage of 60 to 80% of the Black community is religious, right? And most believe that prayer and faith are often seen as a salve for mental health woes and may be favored over medical treatment. You know, me being baptized in 2016, I could honestly say I see that, because certain things that people would just be like, just pray on it, you know? But I believe God gifted people with the ability to be therapists and psychotherapists and all that, so that they could heal the people, you know what I mean? And lastly, obviously, they said the phenomenon of criminalization of African American and Canadian behavior of the Black community. So when as I mentioned, earlier, when especially Black men are in mental distress and the police get called, you know what I mean? They're automatically viewed as a criminal. They're not viewed as someone with a disability. They're not viewed as someone with a mental health issue or concern. When we go to our work, right, and we're talking and maybe we're in a heightened state, we're not viewed as someone that may be having a mental health issue. We're viewed as being hostile. We're viewed as being aggressive, right? These things, all that we also internalize, is a big reason why mental health issues is running rampant in a racialized community and is going uncared for.
Yeah. So, yes, guys, take notes. So let's go into the personality disorders. And why I thought this was important is because I honestly think there's a lot of people out there who are undiagnosed and just living their best life, and and the way their mental health issues affect others around them is not something that is in their conscious or in the conscious of the people around them. So in personality disorder, again, all of these categories have a lot of mental health problems, but for sake of time, we'll focus on only the ones that we think that is relevant to talk about. So there's personality disorders reflect characteristics and traits that are expressed inappropriately and become maladaptive. These enduring and inflexible patterns of thinking and behavior deviate from the expectations of society, leading to distress or impairment. Some forms of personality disorder may interfere very little with the individual's function, while others may be very debilitating and cause impairments in social and occupational functioning. So it's very important to know that some of them people function with. So the ones that I wanted to, there's things like antisocial personality disorder, avoidant personality disorder, borderline personality disorder. So I want to touch on, I'm going to leave the antisocial personality disorder for after, but borderline personality disorder it's basically rapid and drastic changes in mood, unstable interpersonal relationship, prone to impulsive and sometimes self-damaging actions. So unstable self-image is also one of them. And it affects a person who understands him or herself, the way the person understands him or herself, and the way she or he relates to the world around them. Individuals with BPD are highly sensitive and have great difficulty regulating their emotions and impulses. They often experience significant challenges in areas of emotions. So they have difficulty managing their emotions, interpersonal relationships, they have difficulty sustaining relationships, and in the self. So difficulty knowing who they are and how they feel and what they like, feeling empathy, or even they feel lonely, but they have also issues feeling empathy. Their behavior are very impulsive and risky. They tend to end up using substance abuse or things like binge eating or gambling and so on and so forth. And then it also affects their cognition, difficulty with concentration or problem solving, paranoid thoughts in response to stressful events, delusion, and sensation of feeling that they're not in the connection with reality. So the reason why I want to highlight borderline personality disorder is because I think I'm biased by my work, but I see it a lot of it, and it goes undiagnosed.
Yeah.
And when it's diagnosed, there's not much treatment for it.
No, because it overlaps so much.
Yes.
Like the National Alliance on Mental Health has said that BPD is one of the most commonly misdiagnosed mental health conditions. It's so misdiagnosed, in fact, that there isn't even an accurate prevalence rate for the condition.
Exactly.
Because it overlaps with so many, you know what I mean? It's for me, like, having friends who have BPD, and also like when I was going to doctors, the questions that they were asking to try to say such and such, but like it really kind of encompasses a whole lot of like you said, body image. Like if you're in a relationship with someone, it can manifest as in, it's like, if they're a few minutes late, right away, your thoughts. You formulate thoughts that are not necessarily on facts, But thoughts that have to do with, you know what, maybe this person doesn't love me, you know what I mean? Maybe they just don't, they don't like the way I look, you know what I mean? It's like 5 minutes late and it's like, you don't love me. I'm calling you a million times, you don't answer. I cannot stop myself from calling you back. I'll call you 50 times in a row. It's not because like the person's trying to be harassing, but it's because they need that constant reassuring that you love them, that you are there for them, you know? It could also look like them constantly comparing themselves to everybody you like on Instagram. You like a girl's picture, they're going at it. Why do you like her? What does she have that I don't have? In the impulsivity of it, it could be even, you know, having those thoughts without facts and you associate feelings to it. So I think that you're 5 minutes late because you don't love me and now I feel unloved. And because I feel unloved, now I'm acting on those emotions.
Yeah, I'm going to come find you.
And it's crazy how it could segue into so many different things. And that's why a lot of it leads to eating disorders, but not just anorexia and stuff, overeating, right?
Yes.
Overeating and everything like that.
Even like physical violence.
Yeah.
You know, if
The
you're a man,
impulsivity in that too.
if you're a man and then you have all these thoughts and then it's towards your girlfriend and you're gonna hit her because
you have those thoughts, even without it being a fact. And that's the impulsivity of it too. And then we have to think about all the people who are incarcerated right now at this moment, right? With undiagnosed, mistreated, untreated mental health concerns. There's a really high incarceration rate of people who have mental health issues, you know, and unfortunately, if you're not white, you don't really get the same grace that other people do in regards to getting psychiatric help, especially if you're already institutionalized.
Yeah, and there's also this, I'm just going to touch really quick on this one, like histrionic personality disorder. That was new for me. It's excessive emotionality and attention seeking. And then you have narcissistic personality disorder. This is described with grandiosity, need for admiration, and lack of empathy. I thought this one was interesting because a lot of people will call the same person narcissistic and psychopath.
Yeah.
So I thought that was very interesting to highlight. Do you have more on narcissism before I get into it?
So this one is actually from the American Psychiatric Association. So they said it's also several types of personality disorders, as you mentioned. It's a mental condition in which people have an inflated sense of their own importance, and troubled relationships and a lack of empathy for others. That's what stuck out for me.
Yes.
That's what was stuck out for me. And that's why sometimes people say they're also sociopaths, psychopaths, because it's the lack of empathy. It's the bigging yourself up, is the seeing hurt in someone, manipulating things to get your way, disregarding that hurt holistically, you know what I mean? And not being empathetic towards them at all, right? And then when we look at the antisocial personality disorders like sociopathy and psychopathy, you know, it's like which a person constantly shows no regard for right or wrong and ignores the rights and feelings of others. Once again, that sounds like lack of empathy.
So I want to add to that. Psychopathy. Few psychology terms stir up confusion, such as psychopathy and sociopathy. Even though it is commonly thought incorrectly used to describe someone who has a mental health condition, psychopathy is not an official diagnosis. It doesn't exist. They don't diagnose that.
Yeah, they say they're considered to have severe form of antisocial personality disorder, but it's not an actual disorder itself.
Exactly. So instead, it's an informal term often used for a condition called antisocial personality disorder. That's what it is. So the diagnostic manual, the DSM-5, does not list psychopathy as an official clinical diagnosis. However, I think the ICD has sociopathy in it.
Yeah.
I think.
Yeah.
From what I remember from school. The true definition of psychopath in psychiatry refers to someone with antisocial personality disorder, explains a doctor here, and describes a condition marked by patterns of manipulation tactics and violation of others. So it's important to know that, first of all, there's a huge difference between a narcissist and a psychopath.
Someone with antisocial behaviors,
Yeah.
A narcissist can be very social.
A narcissist, yes. And a narcissist is more inward. It's more, I'm the best.
Yeah.
I matter more.
You work for me.
Exactly.
Your feelings don't matter. Mine feelings have to be at the forefront of everything. Yeah.
So, so basically, a clinician regards psychopathy as a more severe subtype of antisocial personality disorder. So you can have antisocial personality disorder, but if you're considered a psychopath, that's like at the end of it.
Yeah, that's over.
You know, you are so behavior that conflict with social norms, disregarding or violating the rights of others, inability to distinguish between right and wrong, and difficulty with showing remorse or empathy, tendency to lie often, manipulate and hurting others, and recurring problems with the law, general disregard towards safety and responsibility, and expressing anger and arrogance on a regular basis.
It's okay, y'all. She's sick, man. What are you gonna do? What are you gonna do?
Yeah, I had to work.
You know? But yeah, no. Yeah.
And also something that is good to know, like you were saying, lack of deep emotional connection. That's a big one for psychopaths. Like you could be in a relationship with a psychopath and they mimic what it's like to be in a
Honestly,
relationship.
sometimes I feel like a psychopath. No, I'm laughing, but it's not funny. Like sometimes I'm like, am I doing this because it's like to appease? You know what I mean? Like, sometimes it's manipulation too,
But
a little bit.
I don't believe you are, because I don't think lack of deep emotional connection is you.
Yeah, no.
You can fall in and out of connections.
Yeah.
But the lack of it, I don't think so.
No,
Have a superficial charm about them. That's real. Like everybody likes them.
Yeah.
Nobody doesn't like them. Be very aggressive, get very angry sometimes. So it's very important to know the difference between narcissism and psychopath, because, I personally have used them interchangeably.
Yeah, so have I.
But no, that's not it. But what would you say about, psychopaths and narcissism? Because for me, I believe...
Oh, you see how she slowly whipped her hair. She went...
For me, I feel like these are the most commonly undiagnosed mental health problems. I feel like we live in societies that promote these mental health problems. So a person who's narcissistic or who has antisocial behavior to the extreme of being a psychopath can and will thrive in our society.
In a capitalist society, for
Yes.
sure, especially as a non-racialized individual, having a lot of money, owning a business, running a business, CEO of some big Fortune 100
president of the free world.
Yeah.
And for me, that's when it becomes problematic, because a lot of these, in the propaganda of pharmaceutical companies, like promoting anxiety and depression and this. So I feel like there's like this propaganda of like telling people that you are actually depressed. You're depressed. You have anxiety because then I can sell you medicine for it.
Yeah, but narcissistic personality disorder doesn't get the same type of attention.
I mean?
Why? Because those qualities, there's a lot of qualities what society promotes.
Exactly.
You are the best.
Yes.
Come on, the Western world is an individualistic world. Our countries, where we come from, our family, our heritage is collective.
Exactly.
Right then and there is a different approach to everything.
Yes.
It's us. And then in where we are now, it's me against you. So these narcissistic behaviors and tendencies are actually honed more in the Western civilization and promoted and appreciated.
Yes,
I am
celebrated.
the best. Tell
Celebrated.
yourself you're the best. Wake up in the mirror. Tell yourself you're the best. Everyone else ain't shit. Not necessarily that, but technically that's what it is.
Yes.
I'm the best. No one can tell me nothing.
Yeah.
I know best. I know how to run my business. I know how to run my life.
Exactly.
I have the best clothes. I wear the best thing. I look the best when I go out. You know what I mean? All those little tendencies, like what people say would be conceited, once taken to another level now, it really does become narcissism.
Yes.
You know what I mean? And the worst thing is when you have someone with these type of mental disorders that are more accepted in society, right? With someone with like depression or anxiety or BPD.
End. So what does that lead to? Marital conflicts.
Yeah.
It leads to abuse.
Yeah. Unbalanced relationships.
Physical, emotional, psychological abuse. I see this in my work daily. You know, mismatch of people who are at the extreme ends of mental health, and they don't understand what's not working. No, you can have generalized anxiety disorder and be with someone who has antisocial tendencies, because then it's a recipe for disaster for you. You know, so for me, I think that's when I think about mental health, that's one thing that I really struggle with, is the fact that we're now everybody's gonna say, when they're anxious, they're gonna say, oh my God, I'm so anxious, I'm so depressed. Even when
you could be depressed without having depression with a capital D. Like, you could be anxious and feel anxiety without having anxiety disorder.
But what I'm saying is that people use these terms
Interchangeably, yeah.
not even interchangeably. Like, it's a bad Friday. Oh my gosh, I'm so depressed. You know, I see that, and it's problematic. Like, it's taking the attention away from the real problem. And some people are dealing with these issues for real. You know what I mean? Like, I don't, because I hear that a lot. Oh my gosh, so...
Yeah, because you know what the thing is? Someone can feel depressed over, like, dropping their cake on the floor. But is it a disorder? That's the thing, right? And I think that's where the nuances lie, you know what I mean? Like, you know, I feel depressed, like, you know, no one called me to check up on me and it's my birthday, you know what I mean? I'm not feeling it today. Or I am dealing with depression. I've been in my bed. I haven't showered for 2 weeks straight.
Yes.
You know what I mean? It's different.
But the point I'm trying to make is, like, we have to be mindful of the way that we talk about these things, because they're really serious for certain people. And so, you know, we just have to think of that. And before we close, I just want to highlight that most of mental health problems are treatable, and there's a lot of help out there. Like, I think that if you are experiencing mental health problems, you should definitely seek out help. You should talk to someone you trust. There's many services that you can have access to, and a lot of these services, they're not promoted, but, like, you can go to the CLSC, you can seek help. There's helplines and things like that. Maybe we should add those to our...
Yeah, I'll touch on a little bit before we close, and we could share them on our social media as well.
Okay, so you can go ahead.
Yeah, so I just want to provide some information from a psychologist at the University of California School of Social Work on for how, you know, Black and racialized communities can really overcome mental health stigma. And one of them, they said, is by shifting our cultural narrative. So destigmatizing mental health care within Black communities requires shifting harmful media narratives and removing systemic hurdles to access, right? So the psychologist, Dr. White, says it's crucial that we tell stories that prove that people can overcome mental illness and lead rich, fulfilling, successful lives. This requires a shift in the way we portray mental health, you know, and also in the way we treat mental health. She also champions culturally competent care. So in my line of work, we do a lot of trauma-informed care, right? And recently I've had to done some workshops for practitioners on culturally responsive practices, because you can't miss out the trauma without adding in the cultural aspect of it, right? So she says this treatment is specifically designed for marginalized populations and led by practitioners who have a firsthand understanding of the unique challenges facing minority communities, right? So you can't expect to have clients that are indigenous without really understanding the plight of that colonialism has had on their culture, on their way of being, on their wellness, mental health, and everything like that for generations. Yeah. You cannot just have Black clients without really understanding the impact of racism, colonialism, displacement, segregation. You know what I mean? We see it everywhere. You have to be culturally competent in
systemic racism.
And systemic and institutional racism. You have to be culturally competent as a practitioner in order to really service and work with, not for, but work with the clients that you serve who are racialized. So just listing some local, I know, you know, we're talking about stigma in the Black community. It is something that people still do not want to talk about as often, but there are some local groups and community organizations who are doing things. There's the Black Healing Fund that I even looked at to refer one of my clients to, who really wanted a Black psychologist. There's Psychology Today that I'd be going through too, looking at, like, you know, looking for Black psychologist, Black therapist, Black healer. There's also the Black Mental Health Connections, which you could also find them on Instagram, and they have a website as well. And there's My Mental Health Matters. So, you know, these communities are, you know, gathering together professionals and people with lived experiences, just to offer support, to be like a support hub for individuals. Since we know now, if you have a mental health issue and you want to seek help, there's a 2-year waiting list.
Yeah.
You know what I mean? So they kind of created these grassroots and group organizations and communities so that people who need the help can get the help right away.
So to finish off, I just want to say we can all do better individually to promote our mental health and others. So what can we do individually to promote mental health?
Talk about our experiences and how we've overcome certain plight, and even some things that we're still yet to overcome. You know what I mean?
Yeah, and
being transparent.
I believe that we should start definitely with self-awareness, knowing yourself. What is your childhood trauma? How does it correlate with who you are now and your actions, your thoughts, and your behaviors? And we should really minimize toxic behaviors that are not helpful to other people's mental health. And, you know, this could be as easy as not ghosting someone, you know, just tell them.
Or maybe ghosting if it helps your mental health. It depends. It's a thin line. No. Ghosting is a thin line.
No, but, you know, you talk to the person, tell them, you know what, it's not working out because we have to take care of each other's mental health. Be honest
about your feelings. Be honest about your feelings. I think that's a big thing that leads to a lot of our situations turning so negative. We're not honest with ourselves, with how we feel, with how others make us feel, and we're also not honest with the people around us.
And you're right. Like, block the person if it's a narcissist.
If it's a narcissist or a sociopath, block them.
Thank you for tuning in.
All right, till next time.